very much for the opportunity to be here. It just so happens I was doing some work in Europe last week for a big meeting, and so it was just fantastic to be here. And it's actually quite ironic that Ralph's back in my hometown and I'm here, so between us we can share our thoughts. I just wanted to say that the network in my mind is one of the most critical and profound safeguards that we have for local area coordination. And so I'm really excited to be here, and Nick and Kat, I just wanted to say great job organising the day, and Sian for Community Catalyst supporting the network. We'll look back on this as being something really important. I also just want to acknowledge some other key people. So Ralph, we've already acknowledged. Ralph, most people didn't know that Ralph did 5 years largely unpaid work to get local area coordination started before anything really happened. So he's been on a long journey, and I want to acknowledge his leadership. I also want to acknowledge, I think we've got some real legends here. So Neil from Derby and Les and Tanya from Thurrock, 6-year journey. We talk about authentic leadership, but I'll tell you what, these three people are some of the best I've seen in local area coordination anywhere in the last 10 years. So I just want to acknowledge it's a pretty tough road, and just how powerful that has been. I also want to acknowledge all of you as local area coordinators, the great work you do, the contributions you make to the people you support, the communities you work in, the changes you help making in the system to make it better at supporting people. And I had some amazing conversations yesterday during the afternoon last night, and I just loved it because it was full of passion and energy and commitment and argument about first principles, which I just think is absolutely what we want to see with local area coordination. So I think we're going to have a really fantastic day today. So I've only got about just 12 minutes to go, so I just want to give a bit of a helicopter view of looking back on 30 years of local area coordination, sort of a very wide view, the journey so far, and also where to next. And just historically, if people haven't got the full history, nearly 30 years ago we started with one country area in Western Australia, one community, one idea, inspired by some great Canadian families and led by some wonderful people locally. One project, really solid values. We got it up, got some evidence, we built it to other country areas, other disability groups, metropolitan area, and then within a period of time we had a complete statewide service. And so it's an interesting journey of over 10 to 12 years, going from one project through to a complete statewide coverage. And so I was very privileged to be part of that. But there was also a very intentional redesign of the service system as we rolled it out. And I think this will be one of the challenges I'll come back to about, is local area coordination something on the edge, or are we sort of moving the system out a bit and creating room for local area coordination to do its work, and then seeing the rest of the system change. We then saw in Australia other states and territories take on local area coordination. We also did national strategy in Scotland over about 10 years. We had some projects in Belfast in Northern Ireland, various projects in Ireland currently, and also the wonderful work here in England and Wales, which I rate extremely highly. There's some work in New Zealand as part of their national reforms, and also in Australia, we took my state, the complete statewide coverage now to local area coordination as part of the design of the National Disability Insurance Scheme. And I think at last count, we've got just over 2,000 local area coordinators right across the country, supporting literally now hundreds of thousands of people. Not perfect, but it is a sort of a bit of a case study of one project led to a statewide expansion, now to a national development. I also just want to reflect the fact that we did some interesting work to start with. It helped inspire some people here, and then you people took the work beyond disability to other areas of health and social care. You've inspired us, and now I'm working with projects where we're taking your learning and applying that in our situation. So I think this cycle of international learning collaboration is fantastic. So just the long-term evidence base, Western Australia, many published studies documenting each step along the way, solid evidence-based learning, next step, with a particular sort of focus on outcomes, individuals, families and communities, but this concept of value for money, and then using the learning from local area coordination to help the system changed the way it thinks. And I could probably map back to changes in our strategic plan every 5 years that captured the learning from local area coordination. So it was a driver for the whole system to learn about doing things differently. Various other studies there, ministerial reviews, value for money studies, productivity commission case studies, various national reviews. Some of the very best have been from England and Wales, I want to acknowledge that. Look, the big picture here is if people have taken the framework and implemented it with fidelity, the results are almost a mirror image across different countries and different target groups. Where people have watered it down and cherry-picked particular parts of it or taken shortcuts, you get variable outcomes. And so my sort of take on the long-term evidence is the Australian example is the best example of a complete system reform from go to woe, but the England and Wales example is the best example of local area coordination across a broad range of health and social care groups. So we've got two complementary, and the rest I would say is if you want to take shortcuts, you'll get half the results. So the learning there is about variable implementation. And just in WA, where I came from, so that in a mature system, LAC is on the ground working with 50 to 60 people, plus some others with a softer touch. Very much the sort of community preventative sort of focus. But there is a question here about how far you go down the end of people with more complex needs and significant challenges. Lots of local officers, strong connection to the community, and this concept very much of starting in the right place and a series of interconnected strategies, but then leading to a carefully designed system of direct funding with graduated amounts of funding that were readily available through local area coordination to support people and to support their natural and community supports. It also had a neat spot in the overall system of support, so it was integrated into the total system. Now, just want to talk a bit about the framework. You've all seen the framework, so this is the sort of the Australian version, and as Ralph would say if he was here, everything since then has basically taken these and just tweaked them a little bit, but the framework has been really robust across different countries, different target groups. So we've got this very strong sense of core values and principles. The next slide is one that many of you that have worked with Ralph will see the graphic that he and Simon Duffy came up with, and some of the key concepts that have been used to describe the practice framework in England and Wales. Now, I'm going to give you a sneak preview. So Ralph and Simon Duffy and I have just been working on trying to update the graphic a little bit to represent the fact now that local area coordination operates in many different countries and many different target groups. So we've just sort of tweaked it a little bit, and I just want to give you a little bit of a preview and maybe get some reactions during the day. And so if you start with step number one, it was the little vision star. We've now reframed that to be getting to know and listening and understanding. That's the starting point. We've then, number two, we've used the word, it was just strengths. We've now included the idea of discovery and dreams and needs. We've included the arrow number three and a focus on sort of short-term one-off support versus some longer-term capacity building. So a very strong focus on capacity building. And this might also be where you might have a shared agreement with people, where you're going to be jointly working on something for a period of time. Down towards the bottom, the community graphic is now community life and mainstream services, which represents our very intentional work to make mainstream services more responsive to people. And the eligibility one, number 9, we've got the universal symbols of money in different languages, and it's a broader concept of eligibility for funding and support. So this is just early days. Ralph's also checking this out with a few people, so I'd be interested in people's feedback. We very much want to convey that it's a connected series of strategies and that there's a series of work here, and funding and services are the last thing that we do. But sometimes people do need funding, direct payments, support, and then we'll take that from there. But the framework is essentially the same. Okay, this next idea about quality and safeguarding, again, you've probably seen some of this, but I just really wanted to crystallise that I think we've spoke about the LAC practice framework as being one thing, and then some of the implementation issues as being like a secondary thing. The clear view now, this is all part of the practice framework, because people take the principles and all that, and then they create all sorts of different concoctions of what local area coordination might be, and as opposed to having fidelity in design and actual implementation. So it's split in two areas there. The first one about the level of the authorising environment. This is a concept that I've paying a lot of attention to now in terms of, I think the spot that local area coordination is in at the moment in the UK is competing with a lot of other similar approaches. Sort of strength-based approaches. Now, what is local area coordination? How is it different? Where does it sort of fit in? So I think being able to communicate the public value of local area coordination and what is unique about it is absolutely critical. So it's this sort of concept of the value, the public value of local area coordination and how we capture that, but also how we can progressively feed that up to heads of social services, politicians, ministers, people more sort of broadly. So this idea about working upwards and outwards, including the media, as well as looking at the integrity of the work we do within local area coordination. Of course, all the work around the relationships, the job design, the recruiting the right people, all those sorts of things. So this idea of quality and safeguarding is incredibly important, and the idea of a network for me is one of the most critical things. For example, in the Australian context, we've got local area coordination delivered through 12 partner organisations spread across the country, and consistency and quality across all those partners is the key thing. So having a strong network is absolutely critical. Okay, just a couple of reflections. I got a group of people together in Western Australia last year that were long-term people that have been involved with local area coordination from mixed backgrounds that were around when I thought local area coordination was at its very best. And we just spent an evening thinking about what was it about the work that we did, how we worked, who was involved, how things happened. And so some of the key reflections were, of course, relationships are the key, the connection and belonging to community, the community ownership. But there's one here I wanted to focus on was the partnership with families and strong family leadership, which is actually something I don't see much written in the research and the publications around local area coordination. So I just want to reflect on the fact that for vulnerable people, often family are the most important, enduring resource that people are going to have and relationship in their lives. And so in fact, we had done quite a lot of work around intentional leadership development with families and create a platform for them to lead, particularly around families of children and also families of other people with significant vulnerabilities. This concept of information and the right amount of challenge, the value skills and the training and the forums like this, and then sort of this collective, connected and consistent leadership. And I've spoken to some of you that are now local area coordination supervisors or managers, sort of, or senior LACs. Can I just say to you, as you grow and expand, that's the critical connection. If you get that right, it stays connected. If you get that wrong, then you start to get this sort of split between what's intended, what's happening on the ground. So those of you in those roles is incredibly important. We had a leadership exchange in Thurrock a year or so ago, 2018, and this was part of some work I've been doing with this International Initiative for Disability Leadership, where we do intentional leadership exchange and development between various countries. We're very kindly hosted by the network in Thurrock and Les and Tanya, and so we had people from 5 different countries. I was just blown away by the collective leadership that was there, the amount of buy-in to local area coordination, the depth and the quality of the work. It was really inspirational. And again, some of the key reflections were the growing international evidence base, the power of relationships, the focus on a good life for people, the importance of shifting power from systems to citizens. And I guess if I could be a little bit provocative, I could sort of say, I've always conceptualised local area coordination as being a shift in power, from systems and services to people, so that people are supported person by person. And in my mind, that's also meant public resource does better when it's closer to people and controlled by people. So I guess one of the things on reflection is probably thinking that, sort of reflecting on your relationship with direct payments and how that sort of works, and whether that might be a leverage to increase the impact of local area coordination system, because this journey about people getting more power and control needs to be extended to the services and the support they receive. And so direct payments is a very important lever that might be used in that process. Integrity and authenticity, so Sian has spoken about that. Authenticity lasts forever, and integrity. Leadership, there's a big issue about, two big issues. One is about look around the room and how many of us are getting towards the end of our careers, you know, and how many young people have we sort of got in the room and coming into leadership roles. That we find to be an incredible sort of challenge. So I'm now working on sort of much more explicit emerging leaders strategy so that we have got intentional investments in collective leadership by a group of much younger people as part of the work that we're trying to do. And also this international learning network, how much can be learned by people that are doing similar things in different contexts. So just want to finish up a little bit on incredible journey so far. I think you people have done amazing work in England and Wales, and I just take my hat off to you and say well done. And just so thinking about the challenges, this is sort of, I've seen every version of local area coordination over 30 years. The good, the bad, the ugly, the ones that started good, that got off track, those that sort of started bad but got on track. So some of the reflections here are the ongoing and never-ending challenge of fidelity. And so this is about preserving the core values and framework, but recognising that you work in a context, a local authority, a country or whatever, where certain things are important, okay, to the community and to the government and all that sort of business. So this sort of being able to preserve the core, but then to move through and develop local area coordination through its various phases. Encouraging the heart and sustaining commitment. Can I just say, if you sign up for supporting people to change power in the system, you're going to get a beating. I think you all know that, because it's tough, because you're challenging you know, the way in which things are being done, you're challenging traditional systems. So reminding us all about why we're here, the stories and the values and the depth of our convictions, and doing that over and over again to keep the fire burning. The international evidence, I think, is incredibly important. So there's been some really good reports written, so keeping that going. I think there's a bit more work to be done around the metrics. I think everybody now is doing social return on investment, and so it's getting very hard to say what's local area coordination versus all these other things that are also coming up with creative social return on investment. So our public value metrics, I think, need a little bit more work. The upwards as well as within local area coordination, safeguarding and development. So again, the network, if I can say to you, this network is so precious and valuable. Please don't ever let it not thrive. I think we're at a point now, some of the areas have been going for 6 or 7 years. So some of you have just started, so it's all about getting started and getting it right. If you've been going at it for 5 or 6 years, you've got a real crunch point about, are you a project on the edge of the system, you know, in the prevention sort of space, or are you going to make an impact into the system? And if so, what's that going to look like? Okay, I want to share a story with you. Early days of local area coordination, we had some very successful country work. We had a big decision about what we would do in the metropolitan area. And people said to us, oh, this will never work. You know, the metropolitan area, the big city is very different to country. But we sort of went back to the evidence. So a colleague of mine, Greg Lewis, and I went back to the evidence, which was about what do we know that really works. And then we were confronted by, we knew that work with, 50 or 60 people in a local area, then we thought, shit, we're going to need hundreds of these local area coordinators. How unrealistic that is. Okay? We drank 3 bottles of wine that night. It was halfway through a 2-day big strategic planning thing. And where we sort of ended up was, we'd go with the evidence and say, no, we're not going to compromise and water down. We're going to say the evidence is that this way of working works. It's got evidence, and these other areas can wait. It's worth doing. We'll grow when we can get more resources. We'll do it properly. And it was that little bit of craziness about, gee, just imagine, we could have hundreds of these local area coordinators. If we hadn't been brave enough to do that, none of this would have ever happened. Okay? It would have just got watered down and potentially lost. So I think there's a bit of an issue here about, is it a project or is it a system change? What's the unique value offering of local area coordination, and where would it sit? So if someone said to you, change your health and social care system, what would you want local area coordination to do, and what else would change? Okay, and I think those of you that have been going for 5 or 6 years, there's a bit of a step up here now about trying to paint a picture of what that looks like and how we can start to free up some of these resources that are stuck in hospitals, stuck in day centres, stuck in residentials, stuck in staff positions. It's about freeing up money in the system and getting it back closer to people. And that's the way in which we make local area coordination sustainable. At the moment, you've got money coming from distant sources, which is really creative, but you don't want to keep on spending your life chasing money. We want this to be a valued, important part of the overall system reform. Okay, so probably just the last thing really is about the importance of leadership exchange and development. And so I chair this International Initiative for Disability Leadership. England have now joined. We've got a framework for rapid sharing of knowledge and information between member countries. We had the Thurrock Exchange here in England last year. We will have an international local area coordination exchange in Australia and New Zealand either next year or the start of the year after. And we're very, very keen to keep on sharing, learning from you people, but also sharing the work that we're doing about trying to reform the system. So on that note, I just really want to say thank you for the opportunity. It's going to be a great day today, and really look forward to continuing to work with you all. Thank you.